Hey, what's up, Hoovers? Do you have pain in the front of your knee? Have you tried rest, ice, and it still continues to hurt? Are you unsure if it's jumper's knee or patellar tendinitis? So stay tuned for this video because we're going to be talking about the differences between jumper's knee and patellar tendinitis. What's good, Hoopers? My name is Marco Lopez. I'm a doctor of physical therapy and certified strength and conditioning specialist and co-founder of the Basketball Doctors alongside with Dr. Gabe Ignacio. Our goal with the Basketball Doctors is to provide evidence-based information of all things basketball. So please help us reach out as many Hoopers as we can by liking, commenting, and subscribing to our channel so we can provide content and valuable information for you guys. All this is just informational purposes. It's not medical advice. Seek out a healthcare professional if you need medical advice or send us an email. So let's jump on the topic today of patellar tendinitis versus jumper's knee or patellar tendinopathy. All right, guys, so before we move on forward, we're gonna talk about the knee anatomy. So here's the knee joint. This is the right knee. We're just gonna go a quick overview. So here is the quad muscles, the muscles in the big muscles that are in front of your leg. They all go into this tendon, the quad tendon, and that goes to your patellar. And the patella is your kneecap. And from the kneecap, it goes to the patellar tendon into the tibial tuberosity, which is this bone here. In the right side, we have the LCL ligament, then we have the fibular bone here, and the LCL ligament holds this side without pushing it out to the outside. Then we have the MCL ligament on the inside part of the knee. Then we also, when we have inside the knee, we have the ACL ligament and the PCL ligament. And these blue little things here, those are the meniscus. So we have a lateral one and a medial one. But the main point of focus is gonna be here in the patellar tendon. Now we know what the patellar tendon is, we're gonna talk about jumper's knee and patellar tendinitis. So patellar tendinitis is inflammation of the patellar tendon. So here's a tendon, it just gets inflamed. Jumper's knee, patellar tendinopathy, is thickening and degenerative changes to the patellar tendon. So they're both very similar because your pain is going to be in the patellar tendon. They both affect the patellar tendon, but they're different in the actual changes to the tendon. One of it gets inflamed, meaning it gets a little swollen. The other one gets thicker, and there's degenerative changes that they've shown in MRIs. So that's kind of like the main thing, the difference between both of them. We're going to talk about how it starts. So patellar tendinitis, it's more of an acute event, meaning, let me give you this example. Let's say you have a big tournament in a weekend, Friday, Saturday, Sunday, and you're playing 3 games each day. And then on Monday, your knee starts to hurt. That's more of an inflammatory process. The knee got inflamed, the tendon got inflamed, you started doing too much in a small little window, meaning 2 or 3 days, your knee gets inflamed. And what happens is the tendon gets inflamed, like we mentioned, but if you rest it, the symptoms should go away. However, patellar tendinopathy or jumper's knee, it's not gonna happen over a weekend. It's gonna happen over a course of 4 to 6 weeks, meaning it's just this constant loading. You're jumping a lot, running a lot, this increased load that you're not ready for, and it's gonna create changes in the actual tendon. So you're not gonna have pain until maybe week 4, week 6, and that's what's really the big difference is the timeline. So tendinitis, it's usually acute event, meaning it'll happen to you over a weekend and then it'll go away for a couple months until you have a weekend and that you play 3 or 4 games. Tendinopathy, it's gonna be there after 4 to 6 weeks of you doing constant back-to-back tournaments, or you're doing a new jumping program while playing basketball 3 to 4 hours a day, and then that's gonna stick with you for a while. So timeline's the biggest difference between the mechanism of injury in regards to tendinitis and tendinopathy. So tendinitis, acute, short-term, tendinopathy, long-term. Now we're gonna talk about the signs and symptoms, and they're very similar. So as we mentioned earlier in the video, both of them, you're gonna have pain in the patellar tendon. However, it's gonna be a little different. So when you have tendinitis, it's gonna start hurting with just everyday activities. So as we mentioned before, you have this acute event, you play a lot of games, you inflame your tendon's gonna be irritated, so even just walking, sitting, normal activities are gonna start hurting. Patellar tendinopathy, however, it's a little different. So it's more chronic in nature. You're still gonna have pain in the patellar tendon. However, you're gonna have pain in 3 different scenarios. So one of them is it hurts before you start playing. So let's say you're warming up, it's starting to hurt, but once you start playing, it goes away. Another scenario is you're fine when you're playing, when you're doing everything, but when you stop playing, it starts to hurt. Another scenario is you need to warm up. Like the tendon needs to warm up, so meaning like early in the beginning, warming up hurts a lot, and then once you start playing, it goes away. So it takes a while to kind of decrease the pain. The biggest thing too is if you touch your patellar tendon when you have tendinitis, it's probably gonna be irritable and it's gonna hurt. Tendinopathy, it will hurt, but it won't be as sensitive as tendinitis. So it's more of this difference of how bad the severity is. When you have tendinitis, it's gonna be affecting you with almost everything. However, when you have tendinopathy, it's not gonna hurt as much, but with activity, it's gonna increase with activity. When you run, jump, it's gonna hurt. However, tendinitis, it's gonna be pretty constant. However, it's gonna decrease each day, day by day. Tendinopathy, you won't see too many changes unless you stop doing anything at all. All right, guys, now that you know the mechanism of injury, the signs and symptoms, next you're gonna ask is, how do we rehab it? So the rehab is pretty different. So for tendinitis, if it's true tendinitis, if you put those checks in our boxes that we talked about regarding the signs and symptoms, mechanism of injury, honestly, rest, ice, and decreasing your load will decrease your symptoms severely, very quickly. Meaning if you have tendinitis on Monday, let's say after that big tournament, you rest it, you ice it, theoretically by Thursday, Friday, symptoms should be severely down and it shouldn't be hurting as much. So rest is your biggest thing in tendinitis, and then working some of the glute muscles. You don't have to completely rest, but just rest from using too much of your quad muscles. However, tendinopathy is a little different. Tendinopathy, because it's thickening of the patellar tendon and there's degenerative changes in the tendon, we actually have to get the quad muscles stronger, glute muscles stronger to really increase the capacity of the tendon. So the biggest thing is tendinitis, it's an acute event, so we could reverse the changes. With patellar tendinopathy, there's already changes in there, and what we have to do is increase the capacity of this patellar tendon to really make sure for you to be able to play basketball, jump, all these activities without pain. So tendinitis, rest, tendinopathy, we have a good plug-in for our program. We have an 8-week program that's gonna address 1, ankle mobility, 2, quad and hamstring flexibility, hip strength, quad and hamstring strength, and also mechanics. And also kind of teach you overall load management, meaning you slowly ramp up. Because as we talked about, one of the risk factors is increasing this intensity, you doing too much over a long period of time. So those are the main differences in rehab. So tendinitis, you want to rest, ice. Tendinopathy, you actually want to strengthen the tendons, strengthen the quad muscles, strengthen the glute muscles, improve your flexibility, and really you have to get on it. As opposed to tendinitis, you could go away with resting it. Because tendinopathy, we always hear people saying, hey, I rest it for a week, I feel good, and I go back and it increases. That's more tendinopathy. If you rest it for a week and go back to your sport, tendinitis usually wouldn't give you pain. It's more tendinopathy. All right, guys, now we're gonna wrap it up. So we're gonna go a quick summary. So tendinitis, inflammation of the patellar tendon. Tendinopathy, thickening and degenerative changes of the patellar tendon. 1, tendinitis occurs from this acute event, meaning weekend basketball tournament, you do a lot pretty quick in a short amount of window, tendon gets inflamed, you rest it, ice it, work on the other muscles, you should be fine. But if the symptoms persist, then you probably have tendinopathy. Patellar tendinopathy, as we mentioned, thickening and degenerative changes of the patellar tendon, is a result of this chronic 4 to 6 weeks of constant loading, meaning you might have started a new basketball program, a new jumping program, you started more practices, and that changes the actual capacity of the tendon. So the tendon is not ready, so we have to get the tendon stronger. And in regards to rehab, the rehab is way different. So we have to strengthen those muscles around the knee for tendinopathy to improve the capacity and also change your mechanics. And honestly, if you want to learn more, if you think you have jumper's knee, click the link above, and here's a video to talk about just jumper's knee in general. We'll go into further depth. But as we mentioned, biggest differences is the timeline. If it's a short time, it's more tendinitis. longer time tendinopathy. If you rest, ice, and it doesn't go away, you probably have tendinopathy. And also another plug-in, as we mentioned again, we also have that 1 week free trial of our Jumper's Knee program that's really gonna address all the stuff that we mentioned prior regarding the risk factors for tendinopathy, Jumper's Knee. And we have the full 8 week. So try out the 1 week. If you like it, get the 8 week. All right guys, hopefully you found this content valuable. So if you really like this video, please help us grow and provide more videos for you guys by liking, commenting, sharing it with the friends and family so we can continue helping as many basketball players as we can. And if you didn't like this video, dislike it and comment below how we can make it better. All right, so let's ball for life, guys.